House Speaker Mike Johnson spoke moments ago, as we've been reporting within the last hour. The GOP-led House passed the contentious budget bill. Here's some of what he just said.
Again, they have been proven wrong. Today, the House has passed generational, truly nation-shaping legislation to reduce spending and permanently lower taxes for families and job creators, secure the border, unleash American energy dominance, restore peace through strength, and make government work more efficiently and effectively for all Americans. House Democrats voted against all of that. So everything that I just said, they voted the opposite. Clearly.
All right, now the cuts in this bill could reduce federal Medicaid spending by nearly $700 billion. This is according to analysis from the Congressional Budget Office. Medicaid provides health care to about 72 million Americans, including crucial mental health services. According to KFF, 35% of non-elderly adults who are enrolled in Medicaid have a mental illness. And that includes 10% with a serious mental illness. For more on this, let's bring in Julie Rovner now. She is the chief Washington correspondent of KFF Health News and can provide more detail as to what's in this bill. Julie, good morning to you. It sounds like the House Speaker is joyful that this has been passed. The health care cuts, though, could be wide-reaching. Help us understand what it entails.
Yes, and some of the last-minute changes to this bill made these healthcare cuts even wider reaching. This is what the conservatives wanted in order to win their vote for the bill, to win those last few handfuls of votes. I'm already getting emails from hospital groups concerned that the Medicaid cuts could require them basically to close down either entire facilities or parts of facilities. We know that mental health care is difficult to come by, particularly in rural areas. There are also some pretty dramatic changes to the Affordable Care Act that were made at the last minute in those large southern states that didn't expand Medicaid, states like Florida and Georgia and Texas. Cuts to the Affordable Care Act will end up with more people without insurance, which will put even more pressure on hospitals that are trying to provide sort of money-losing services like mental health care and obstetrics. That's another big issue.
So if someone's watching this and they rely on Medicaid specifically for mental health services, how would what has just passed impact them?
Well, one of the things that this bill does is it limits states' ability to raise their own money to help pay for their share of Medicaid. That's going to hurt people. But it's important to remember that these cuts will hurt people more than just those on Medicaid and on the Affordable Care Act, because if there aren't enough insured people in a state, either through the private sector or through these government programs, it's going to be difficult for providers to stay in business if they have to provide the uncompensated care. And we will not see, updated numbers from the Congressional Budget Office, I would imagine, for several days. But I would think that their estimates of how many people will end up without insurance because of this bill is going to go up possibly dramatically because of the changes made just last night.
Now, the Medicaid cuts have been among the most contentious components of this bill. It just passed the House, still has to get through the Senate. Based on your reporting, what's the likelihood that any of that might change as the Senate takes a look at this?
Well, the Senate's certainly going to have very different opinions on a lot of this. We've already had some Republicans in the Senate say they will not vote for these deep Medicaid cuts. We don't really know what the Senate thinks about the cuts to the Affordable Care Act. So we're not even quite at halftime of this bill yet, even though it did pass the House by one vote. It does have to get through the Senate, and then presumably whatever the Senate does will have to get back through the House, and that won't be easy either.
All right, Julie Rovner helping us understand at least this stage of this legislation. Thanks for joining us.
Thank you.